If any of you aren't fully aware what British Pakistan Foundation is, just to let you know, we are a very young outfit. We've been around since October 2010. So we have huge plans and huge visions of engagement and to change the map of Pakistan's social development sector and to engage the diaspora community here. So grand plans for a rather young organization, but withstanding that, in the 2.5 years that we have been around, we've seen a huge growing appetite and an interest in Pakistan, which is partly been reflected on what you've heard already today. Just a quick round-robin view on Pakistan and its growth and the opportunities for social innovation or social enterprise, as many people understand it, is not just in the face of having something good to do, or because we have to do, but there is a very strong commercial opportunity as well as naturally a social impact that can be gained. Population growth has already been mentioned. We are 150 million plus. Our growth rate ratio is 1.55, so that's enormous, and it's growing at a pace which is naturally not within a capacity that our state can manage. And 2/3, as Priya's already mentioned, 2/3 is a very young population to have. Our consumer appetite annual growth in Pakistan was last reported at 7.02% in 2011. That shows you the potential for a very strong consumer appetite. We have a wealth of corporations investing in Pakistan, from McDonald's to Standard Chartered to Unilever, who are there for a reason. They make some serious commercial output from being in our region. Human capital for a country that has 180 million plus, the country's social sector is traditionally underperforming because it is not invested in. So just to note, many people have bandied around the label that Pakistan is a failed state, and certainly back in 2008, the government did look for a bailout from the World Bank. But it's not failed in the sense that as an opportunity or as a country, with the human capital we have, with the resources we have, we are just not invested in as a nation. So again, the opportunity to invest in human capital is vast. The natural resources, which is something that Alan and Overy colleagues alluded to, we have gas. We have a large resource of gas, copper, gold, and that in itself is not just a resource for our own consumption, it is something that is also being looked at to use for commercial gain for the state as well. So we have some serious elements to invest in. Looking at certain sectors that we can highlight case studies of innovation, I've picked a few, which is in keeping with the EPG report. The first one is telecoms and microfinance. Imam also alluded to the mobile sector, the telecom sector, as a viable platform to actually outreach to a rather large burgeoning population. And we have a couple of examples where pilot testing has been run. One of the more known models and a very successful model has been the Easy Besa model. And this was a microfinance pilot. A deal was struck between Tamil Bank, which is a local bank in Pakistan, Telenor, which is a local telco, and DFID invested approximately 12 million in the initial piloting. The reason the deal was struck was DFID's private sector investment wing in Pakistan realized that they could broker a private-public sector joint merger or shared merger, for want of a better word, if they were to underwrite some of the risk elements. So the 12 million investment was part of the underwriting of risk for the bank that came on board for this particular pilot. What they found is the pilot was initiated back in 2010, 2009. It was so successful in its take-up that we now see Habib Bank Limited in Pakistan also replicating that process. So just to give you an idea, the Easy Besa model completed 83 million transactions, and that's a collective worth of 178 billion rupees. And that was just one initiative. So that gives you an idea of not just the scale, the opportunity, but equally the impact. And it impacted the rural entrepreneur, the rural farmer. And as I said, HBL is now looking to replicate that model elsewhere. The second aspect of it was the Easy Pesa agri-market link. So they realized this was a viable platform to use to message out to your rural farmers. So not just elements of access to funding, but also information on market access, the price of, or the rate of fertilizer, the price sharing of crops, etc. So that information is being disseminated very efficiently. As you're aware, the mobile phone access penetration in Pakistan is vast. So there are no censored landlines or broadband, but the mobile phone penetration is something which is accessible and it is at a high penetration. So this platform was seen as a very viable and very low cost way of disseminating very key information, and it worked. The other sector, which is again an area which has seen some levels of investment and innovation and also is very viable for our agri-based market, has been the dairy farming area. And we've seen a few very recent models where there's been investment. Apna Arish Pakistan is a very grassroots NGO, started by a young girl in Lahore who felt that the lack of social mobility, especially in the agri communities, is hugely missing, and the grassroots investment is missing. So the actual upskilling and again the knowledge sharing and the tech sharing within the farmer community just does not exist in Pakistan. So she, along with various other stakeholders, collaborated in ensuring some sort of platform of knowledge sharing for the farmers. And that was the first kind of social justice or social awareness for agri-farmer business that came about, and again, very recently. Then we've seen another angel investor, as Iman alluded to earlier. We have a lot of young entrepreneurs in Pakistan, or kids who have lived and grown abroad and come back to their country of origin, or their parents' country of origin, and realize that the lack of expertise or the lack of social justice means people who could be increasing their wealth and capital just aren't. So we've seen a young young American Pakistani girl. She set up Invest to Innovate. She brought with her various contacts from the US, set up an angel investor hub, and they have now launched their first dairy project, looking at eco-energy finance and working with an organization called Milk Off in ensuring dairy cold chain activities in one of the areas in Pakistan. Then many of you know Acumen Fund, which was set up by Jacqueline Novogratz, I think about 2009. They have their HQ in Pakistan and Karachi. They recently set up an initiative with Jesser Farms, again grassroots farmer entrepreneur, to look at yield in the breeding of their cattle, to increase the yield for dairy sort of yield. So that's another area that has seen success in a very short period of time with not huge amounts of investment. So it's in a combination of expertise sharing, investment and co-collaboration. The other area that's seen a lot of investment has been the health sector. And this has been sort of even more, I could say, active or burgeoning because of the recent floods in our country, the catastrophic floods of 2010, and the subsequent year-on-year floods in Pakistan have meant that many of the international agency development work has constantly been stalled or put back or put on hold because of the natural disasters that we're facing, unfortunately. But in the face of that, what we have seen is local and international agencies working more and more with very grassroots, very sort of localized NGOs, ensuring that some levels of innovation are also brought into those opportunities in the face of disaster. And one of them I wanted to highlight was the mobile health clinics. The Real Medicine Foundation had worked with a local NGO in the Sindh area, which was heavily hit by the floods. And this was technically taking mobile units into backwater areas, but not just physically taking medical help to them, but also ascertaining and predicting medical needs on the ground so that they were able to be more and more efficient each time they would make those visits. Another area which is being currently scoped is the Chikungunya Health ID cards. something which a maternity health charity based in the UK, run by Pakistani medical practitioners here in this country, are looking to replicate what you would have, say, in the US, where you have a health identity card. So that would hold all of your health history, and they would be able to then predict and understand what medication or what health intervention you've already had. So that's kind of being tested and introduced in the next year or two in the Sindh area. We also have an initiative which is being looked at to upskill DIs. So if you're not aware, in our part of the world, in most of the eastern region, you have health or maternal attendants who are not skilled, who are not trained, but it's a method or a system that's been used for centuries. The government of Pakistan does not recognize the DI, though they are pretty much used by most households in the rural backwaters of Pakistan. So what UNICEF and another health charity NGO in Pakistan are doing are looking to upskill the DI and get them registered. So rather than taking away a system which works for the community, which the community has used for centuries, they are looking to upskill, register, and almost officialize that process. So it's on the radar, it's monitored. And rather than bringing in a system from abroad or from outside, which may not necessarily meet the needs of the locals. So that's another quite exciting area that's being developed. The last on the health innovation is HeartFile, which is an online portal which was initiated by Dr. Suniya Qureshi in Islamabad. She's also a health policy writer. She's a fellow and a visiting advisor for various concerns in the US as well. But she felt that there was a need for very transparent, very efficient data collection in the medical field. We do not have visibility in understanding our medical data. There is none, frankly. So she got 10 hospitals on board. They signed up to the HeartFile sort of data collection portal. And what she did is, with the backing of the Pakistan Poverty Alleviation Fund, she was able to ensure donor-to-benefactor relationship, where people can donate directly via the portal and actually see and have a relationship value with the patient, with the hospital that they're supporting, whether you wanted to support heart transplants or births or whatever, limb amputations. You could actually see where your money was spent. You could actually understand the relationship value, and also the data would be collected to preempt the need of those particular hospitals. So again, revolutionize some of the way donors engage with benefactors, and also collect data for us to understand where the priority needs were in which particular hospital facility, etc. Renewable energy is a very sexy place to be right now. Globally, climate change is the buzzword. Not many of us quite understand what that means. Sitting in the first world, or certainly in Britain, with the radical forecast weather changes here, you think, is this climate change? But in countries like Pakistan, floods, drought are very real issues, and unfortunately very worrying ones. But apart from the sort of day-to-day livelihood and protection of the citizen, what we are trying to understand is how we can create and introduce expertise and technology into the renewable energy sector. So again, we can generate productivity that is quite viable and is quite an opportunity for the citizens of Pakistan. I've given two examples here. The first one is rural hydroponics. The reason I gave that example is you had three brothers in the Chitral area who were MBA graduates who realized that their local surrounding villages had no electricity. And I'm not sure how many people, yes, 45,000 homes. So 45,000 homes in the Chitral area had no electricity. So the three brothers got together, they got investment from abroad, they helped set up a hydro project, and they were able to create electricity, which you and I would feel is a basic human right we take for granted. But 45,000 householders were able to have that for the first time. So again, an opportunity that was driven very much by local young individuals for improving their locales. The second aspect is the government of Pakistan's push for wind power in Sindh. In December, the first wind power initiative in Jampir near Tata was launched. We now have several other projects working with Forgy Fertilizer Company that are in the pipeline and soon to be delivered. And that's some serious megawatt output that can be gained for the said area and beyond. So I've just gone through very quickly some case studies from those various sectors, very much alluded to already from the EPG report and from what Dr. Iman mentioned, the hybrid model, a tiered approach, creating ecosystems, the citizen-to-state relationship value, looking at social justice as a means to create social mobility. It's not just about money and investment. It is very much about investing where it counts. There is no lack of money in Pakistan. It is unfortunately not equitably invested. Looking at the relationship between entrepreneurs in the semi-urban areas, looking at traders in urban areas, looking at the agri-farmers in rural, and understanding where the value chains can be invested in across those groups. What next? Well, the simple solution would be more FDIs, an incubation hub, as both my previous colleagues have mentioned. Certainly provincial buying. I was speaking with Ali earlier, the splitting of provinces, the 18th Amendment, provincial governance or the lack of. These are just labels. What we really need is very much more state buy-in for local investment.